Hello, sir. My name is Arnold.
Hi, how are you?
I'm pretty good. We're gonna do the examination of your head, eye, ears, nose, throat. Okay.
Okay.
So we're gonna start off by inspecting the head. No obvious trauma. The skin looks good, normal color. No obvious acne. Looking at the scalp. Normal cephalic, atraumatic, no obvious lesions. Now we're going to start by palpating the head. No masses, lumps, and the scalp doesn't look dry. Nice, even hair, not very thin. So that's the first inspection, the palpation of the head. Then we're going to move on to the eyes, and for the eye exam we're going to start off. We could either do the Snellen test, but for this, the purpose of this video, we're going to opt to use the hand chart. I'm going to hold it 14 inches from you. Do you use any glasses, sir? No glasses. Okay, if you could please cover your right eye, and please read to me the line that you could better see.
95623
956
528983.
Okay, so now we could take a look here. It's a 20/20 vision. You could rest that, and then now in a few we're going to cover the other eye, and we're going to test the other eye. Hold it 14 inches. Go ahead and
95623.
Okay, that's
the best, yeah.
Okay, so once again, 20/20. Now we're going to test it with both eyes once again. Just read the
95623.
Okay, so that concludes the first part of the eye exam. So now we're just going to do with obvious inspection. Make sure there's if the lighting is correct. No redness, the sclera is nice and white. The iris and no obvious tear drainage or anything of that nature. Then we're gonna go ahead and take a look at the conjunctiva. Looks nice and red. Okay, now we're gonna move on and check the vision, the light. For accommodation, if you could just take a look at me in my nose, please. Okay, now we're going to do the other side. Okay, so pupils are reactive to light directly and consensually, meaning that when I shine the light on one eye, it constricts, and the other side that the light is being shined on also constricts on both sides. Now we're going to check for accommodation, and we're going to do this by, if you could please take a look at the black part. Now take a look at the wall. Take a look at the black part again. Okay, so the pupils constrict when he sees a near object, so we have good accommodation. Now we're going to take a look at the extraocular motor on the eye. We're going to do this. If you could take a look at the pin right here, the tip of the pin, and just follow it, please. Okay. Okay, one final one, and keep on following it. Good. Okay, so there was no lateralization, no nice stigmas. No, he was able to follow the pin correctly, and good convergence. So we're gonna continue on and do the exam on with the ophthalmoscope. Let's get this. Okay, so we're gonna do this by moving to 15 degrees. If you could just look straight, please, and just try to keep your eye on that object. Let me know if you have any disturbances or any discomfort. So we're going to start by a 15-degree angle, and I'm going to inspect his right eye using my right side. Then when we inspect his left, we're going to use my left side with his left side just to avoid any front-to-front issues. So we're going to start by, we're looking for that red reflex. So we got the red reflex. We're going to go in closer. So we visualize the optic disc we localize that by looking at the vessels. And now we're gonna move a little more to that side. We visualize the macula and the fovea. There was it was nice and clear. The vessels, there was no obvious hemorrhage or any rupture or anything on that eye. Now we're gonna do basically the same for this other side. 15 degrees. If you could please continue looking to that eye. Through that wall, I'm sorry. And using my left side, we're gonna look at his left eye. We're gonna capture the red reflex, and then we're gonna close by. We see the optic disc, we see the vessels, no obvious ruptures. We see the macula and the fovea, and everything looks clear. There was no obvious cataracts, no redness in his eye. So this concludes the exam for the eye. But before we finish, we're going to test your peripheral vision. We're going to do that by doing what's called the wiggle test. If you could just look at my nose, and I'm going to wiggle my fingers, or alternatively, you could do it by the numbers, and you just tell the patient when they're able to see your fingers. In this case, we're going to use the wiggle test. So let me know when you see my fingers, okay? No. Okay, so you do all the peripheral vision, and he has a normal intact peripheral vision. Now we're going to move on to the nose exam, and we're going to do a visual inspection. No obvious masses, no redness, no obvious drainage, and any pain, sir?
Nope.
Anything? Okay, so now we're going to visualize inside of the nose, and we could do that by using the light. So let me get that. Okay, so we're gonna take a look inside your nose. If you could tilt your head back a little. Okay, so no obvious drainage, no redness, no bleeding. The turbinates are visualized. Bilaterally, no deviated septum, no perforated septum. Everything looks normal and intact, no polyps. So now we're gonna also taste patency on each nostril. If you could take and the other one. Okay, both are patent. Now we're gonna test the smell. We're gonna test the smell. Can you please close one eye? Okay, and how about the other one? Okay, any
it smells like cinnamon.
Cinnamon, okay, great. So that's for the nose. One thing, I'm gonna head back real quick to the ears, and we're gonna do a whisper test and the Ryan's test. So for the whisper test, I'm gonna include the ear, and I'm gonna say a word, and you let me know what word it is, okay?
Abo.
Okay, now we're gonna move to the other side.
Abo.
Okay, so that's a good whisper test. But as we were moving along with the examination, you would also be assessing for obvious hearing deficiencies. Now we're gonna do the Weber's test, and this checks what's called lateralization. So what I'm going to do is you're going to let me know in what ear or if you hear the sound, okay? Where do you hear it?
Both.
Great, so that's normal, expected. And now we're going to do the Ryan's test, and this measures bone conduction versus air conduction. Air conduction should be greater than bone conduction. So for this test, you let me know when you stop hearing this, okay?
No.
Okay, and let me know if you hear. Stop hearing it. You're able to hear it? Okay, good. So we're gonna do the same for this side.
No.
Okay.
No.
Okay. So air conduction was greater than bone conduction. So that's a normal finding. Now we're gonna evaluate the ear, take a look at the lobe, the tragus, the external ear, no obvious drainage, no redness, no lesions. Everything looks normal and intact. We're gonna do the same for this side. No obvious drainage, lesions. Let me know if you have any pain. We're gonna do what's called a tug test. We're gonna pull at the auricle.
No.
No pain, no pain.
Okay.
And then we could touch the mastoid process to evaluate pain inside the ear. Any pain?
No.
Okay. Now we're gonna take a look at the inside the ear. Let me get the light running. Okay. So we're gonna start at the right side, and we're gonna take a look inside the ear. We're gonna pull up and back to okay. And now we see the tympanic membrane. We know obvious drainage, no redness. It's pearly gray. We see the umba, the short process of the malleolus, and the body of the malleolus. There's no obvious effusion, no obvious perforation of the tympanic membrane. It looks otherwise normal. We're going to do the same for this side. The cone of light was visualized on his right side at 5 o'clock. Now we're going to try his left side. And we're going to go up and back. Okay, the cone of light is at 7. And we also visualize the hallmark structures, the short process of the malleolus, the umbo, no obvious perforation. The cone of light, as I mentioned, was at 7. No obvious drainage or redness. The tympanic membrane was pearly gray. So now we're gonna move on to the mouth. So upon inspection, no obvious skin lesions or discoloration. Lips are intact. If you could please open your mouth, we could use a light. For this, can you please open your mouth? Okay, the tension, the teeth are normal, no cavities. The soft and hard palate are normal. Can you please say please? Okay. The uvula is midline. You can stop. The tonsils are normal. No obvious abscess lesions. No gingivitis noted. The tongue is normal. And can you stick out your tongue, please? Okay. No deviation. So otherwise, the inspection of the mouth looks normal. Can you lift up your tongue? We're gonna inspect the glands. No dryness. The glands are present. No obvious deformities. Okay, we could also ask the patient to evaluate the cranial nerves. If they could puff up their cheeks and make a smile. Okay, so that's intact too. Now we're gonna evaluate we're gonna inspect the neck. The trachea is midline. No obvious lesions or masses. We can also palpate for the lymph nodes, the preauricular, tonsillar, submandibular, submental, anterior cervical, posterior cervical, anterior clavicle, or supraclavicular, infraclavicular, and occipital if we also need to palpate those. So as I mentioned, no obvious masses, goiter, no deviations on that area. We're gonna evaluate the thyroid gland, and with this approach, we can go behind the patient, and we're gonna ask him if he could swallow his water. So I'm gonna hand him a cup of water, and if you could please swallow. So when he swallows, we feel the thyroid, the isthmus, no obvious goiters, masses. Now we're gonna swallow one more time, and we're gonna evaluate the other side of the gland. Okay, so once again, the thyroid gland appears to be normal. We palpated the isthmus, the gland, and no obvious goiter or any deviation. And I think for the most part, most is almost done. Now we're just going to evaluate your range of motion. If you could please hyperextend your neck, then flex it, and side to side to shake the full range of motion. Okay, so otherwise, I think this concludes the examination.